Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Thursday, October 17th. It is 5:02 p.m. Okay, so if you've been watching for the last few days, we talked a lot about poop. We talked about stool color. We talked about poop shape. Shapy poop. We talked about how your entire diet can be reflected in what goes in is what comes out. Okay, so today we're going to extend into a topic again, which is a little bit uncomfortable for some people. Hello, Pamela. Today we're talking about urine. I don't know, maybe that's why I wore a yellow shirt. Not planned. Just telling you. Okay, so your urine can also tell a lot about your health, your diet, and your habits. Urine is what is produced as your kidney filters your blood. Okay, so it filters your blood of excess water and waste material. Okay, hello, Teresa. So things we can look for in our urine is the color, the clarity, if it's clear or cloudy. We can look if there's blood. We can look about how many times you go to the bathroom, how many times you urinate a day, if there's pain when you urinate, etc., etc. So there's a lot of information that you can get from just keeping your eye on it, thinking about it, especially if it's an area that is of concern to you. Okay, so let's start talking about color. Urine is about 95% water. So your urine should be pretty clear to pale yellow, okay? But not completely clear, okay? That may mean you're drinking way too much water or you're taking a diuretic, okay? If you take a diuretic, it forces your body to put out more urine, filters more water than you would normally on your own. So it's going to make your urine very, very clear. Okay, but let's talk about some other colors. Number one, dark yellow. Okay, that is a clear and outright sign that you are dehydrated. Okay, that means your body is doing its best to filter, but it's taking back a lot of the water because your body needs it. Okay, so it's putting out just enough so that you can go, but it's keeping as much of it as it can to keep your body hydrated. Number two, amber, an amber color. So if you're not sure what amber looks like, Google it, okay? But it's kind of like a brownish type color. It can also be a sign of dehydration. So that dark yellow amber can be difficult to distinguish between, but usually that is also a sign of dehydration. Now, if your urine is orange, number three, it can be due to foods, it can be due to medications, but if you also have pale stool or yellow skin, yellow color to the white of your eyes, meaning you are jaundiced, that may mean you have some problems going on with your liver. We talked about that a couple of days ago. So in combination, your urine can turn orange, okay? So be aware of that. Your urine can also turn a very dark yellow if you have liver function problems, but just keep that in mind. If you're taking medications like sulfidine, some chemo drugs, pyridium, other drugs like that may also make your urine turn orange, okay? But that would be something hopefully they tell you about before you start the medication, and you would be very familiar with that because you've been taking it for a while or whatever it may be. Okay, number four, pink or red urine. Okay, foods including beets, rhubarb, and even blackberries may turn your urine slightly pink. Not very often, but it can, especially if you eat them in excess. So if you're eating a lot of it and you notice some pink in your urine, cut back on those foods and see if it goes away. If it does, it was the food, okay? Medications such as ones for tuberculosis, some laxatives containing senna, and others also can change your urine color. But it may indicate in reality that there is blood in your urine. Now, women, make sure it isn't blood from your menstrual cycle, okay? Because that's kind of like, oops, You go off to the doctor, and meantime you had your period, or you were getting it, or something happened, and a little bit of blood got in. And, men, obviously not an issue. If you have blood, if you have red urine and you're a man, that's, obviously of concern. Okay, but things like kidney stones and even long-lasting, long-distance runners or any type of extreme exercise can actually do it as well. But of course, the biggest concern anytime there is blood in your urine for most people is it cancer? Okay, so you need to get that checked out. You need to see a doctor and find out what is going on. Okay, if you are prone to kidney stones and you've had them before and you're having back pain the picture then clearly looks more like kidney stones. Don't panic that you have cancer, but still you may need to see a physician. Okay, number 5, blue or green urine. Okay, dyes in your food may do this as well as medications. Again, you see the theme here. Food or medications may be the first thing you should be thinking of. But the site I read claims, and this was news to me, I had to look it up, never heard of this before, propofol, one of the anesthetic drugs that I use every day I go to work on my patients, can actually cause your urine to turn blue or green. Okay, so yes, it was there. It was case reports, and some people reported it. Never heard of it before. So if you just had anesthesia or any type of surgery, and you have 1 or 2 episodes of blue-green urine, okay, see what happens. Wait a couple more times and see if it clears. Okay, infections in the urinary tract with Pseudomonas or a rare genetic disorder of calcium metabolism can actually do it as well. If you have a rare calcium disorder, you probably know about it. This is not news to you, okay? So that would be something that you wouldn't necessarily worry about. This would probably be going on, on in your life all the time. But Pseudomonas, again, if you're having a urinary tract infection, you would need to have a urine culture to confirm what the causative agent is. Number 6, dark brown or Coca-Cola colored urine. Yeah, I told you when we talk about stuff in medicine, we often relate it to food, and I'm sorry if I'm ruining Coca-Cola for some people, but you shouldn't be drinking it anyway. Again, food and medications may be the cause. Fava beans, rhubarb, and aloe also may do it. Meds including anti-malarial drugs, antibiotics including Flagyl, and laxatives containing Cascara or Senna may do this as well. Medical conditions including muscle injury from extreme exercise like marathon runners. Okay, it's called rhabdomyolysis. You're basically breaking down muscle, and as a result can lead to kidney damage. So this is something that you really need to be watching. Liver and kidney disorders can cause this as well. So most importantly, sudden changes of urine color. Okay, if you've been going along your whole life and it's yellow and then suddenly it turns a weird funky color, time to look it up. Okay, number 7, the last one, cloudy urine. Okay, indicates an infection most of the time. Okay, whether it's a vaginal infection or a prostate infection, it can do that as well. So it's not just an infection in the kidneys or the ureters, bladder, that whole system. It can be outside of that and can affect your urine color. So be aware of that. Now, lastly, about urine odor? Seriously, okay, have you ever smelled your urine after you ate asparagus? Okay, it's just awful if you ask me. Okay, but dehydration can make your urine smell like ammonia. Fruity smelling urine can be a sign of type 2 diabetes or a urinary tract infection, and foul smelling urine can be an indication of a urinary tract infection or a sexually transmitted infection. So if you have other symptoms, frequency of urination, burning sensation when you urinate, etc., may support the fact that you have an infection and you need to see a doctor. So again, hoping that this information is helpful to some people, that I'm not just kind of spouting out colors and stuff that you guys are going, yeah, whatever. This to me is important because these are bodily functions. We do them every single day, and we don't like to talk about it. We just don't like to talk about it because we're private people, or you just don't talk about it. So as my girlfriend said yesterday when we were talking about poop, and she said, oh, do we share pictures and colors? I said, no, that's for crap chat. So sorry for the bad language. But again, we're not here to share that necessarily, but be aware and talk to your doctor as needed. Okay? So hope you guys are learning stuff. And that's what I got for you today. So I hope you guys are having an awesome day. And I will be back tomorrow for another Live in 5.